I started as an EMT a long time ago, and that was my entree to the field of medicine, and it never left me. So EMT led to paramedic, which led to medical school, which led back to doing what I'm doing as an emergency medical services physician. In about 2010, the state of New York and the EMS oversight body identified that actually, up until that point in time, there was no requirement for the ability to administer epinephrine for allergic reactions, anaphylaxis in particular, on ambulances. It was a best practice, but it wasn't actually a regulatory or policy requirement. And so a policy was passed in 2010, which made it a requirement for every in-service ambulance in the state of New York to have the ability to administer epinephrine to an adult or a pediatric patient. Good medicine, right? So at that point in time, it was 2010, epinephrine auto-injectors were number one within the scope of practice of EMTs, meaning EMTs had already been trained on how to recognize signs of anaphylaxis and administer an EpiPen or an epinephrine auto-injector. So it was a relatively easy lift, and the cost back then really wasn't significant. Once that became, if you will, standard of care, a lot of fire departments that often provide first response services started doing the same, recognizing that, hey, we have a tool that can make a difference in somebody's lives. We want to carry it too. Fast forward a few years, and the price of auto-injectors went through the roof. And we saw two different things happening. Number one is those fire departments that were doing the right thing for their communities by voluntarily carrying epinephrine were starting to call me up and say, Doc, we can't afford for our small volunteer agency to carry 4 EpiPens on the load because it's costing us $1,600 a year. They couldn't do it. So they started not wanting to do that anymore. And at the same time, we saw ambulance services being hit with the same massive increases in the cost associated with those. And that prompted the discussion of, can we teach an EMT who is not generally trained to draw up a medication into a syringe and administer it using a needle, how to do that? For me, the thing that would help me the most as an EMS physician and as a medical director is having very low-cost auto-injectors. Because if I had those, I wouldn't have to have even come up with Check Inject. And unfortunately, the reality was that we had to be able to take care of our patients. Mm-hmm. What we can say is that there are a lot of places in our community that have epinephrine today because of Check Inject that likely would have given it up if they didn't have that as an alternative. And that ultimately might be saving some lives.
All across America, anaphylaxis emergency training and stocking of epinephrine in public locations has saved many lives. Dr. Jeremy Cushman was instrumental in New York State in implementation of the Check and Inject program. The Check and Inject program allows emergency medical services in New York State to use syringe epinephrine kits, which are less expensive than epinephrine auto-injectors. The Allergy Advocacy Association is committed to improving access to epinephrine at the lowest possible cost. Dr. Jeremy Cushman has achieved precisely that through the Check and Inject program. As an outstanding physician, fully committed to professional engagement and community service, the Allergy Advocacy Association proudly presents the John J. Condemi Award to Dr. Jeremy Cushman.